Another episode of the Exoskeleton and Wearable Robotic News. We have 11 news stories, lots of job openings, events coming up, so let's get started. First up, in industrial news, the Japan's Assist-Suit Association is launching the Assist-Suit Concierge. So they're describing it as a neutral guide for selection, comparison, and budget considerations, Japanese-made occupational exoskeletons, and an opportunity to connect relevant manufacturers to arrange trials, request talks, or lectures by the association staff or physical therapist. The association usually focuses on occupational exoskeletons, so it's kind of surprising to see physical therapists being included as well. And this is meant to be a free of charge service for companies, organizations, or government stakeholders, I would assume in Japan. And you can apply to it from their website. And I have included both links, both to the announcements and to the application page that go to their website. And as you could expect, it's in Japanese, but you can do an auto-translate for those who are interested to figure out more. A Science Direct has published curious markerless motion and capture study on OpenCap. And the gist of it that I'm getting from the study is that originally it was trained on a regular movement and sports kinematics, and it was producing quite a bit of an error when people or professionals tried to apply it to occupational tasks. So this paper poses the question is, can you get a 2-camera system and retrain it so it is better suited for occupational tasks? And the answer that they've gotten is yes. Curiously, they do not get better results with 3 cameras versus 2 cameras. So this is not specifically exoskeleton use, but matching an occupational exoskeleton to the correct task continues to be a challenge. And doing motion capture, they usually requires sensors, multiple points of view, and a good deal of processing time. So if there is a possibility for the process to be simplified, then that can make choosing the right occupational exoskeleton easier and simplified as well. So it's a case of one technology helping the other. So this is encouraging news, and I think fits to be in the newsletter. Switching over to medical news, there's a study published in the Annals of Surgery on the NekSpine exoskeleton. And there's now a few of them, and I myself have been a little bit confused as to how effective they are. Basically, as if you have work that requires you to lean or lurch forward. So this could be a dentist, this could be a surgeon. Some chemist positions also require a lurch forward depending on how the lab is set up. It's meant to offload some of the forces on the neck and to reduce discomfort or potential damage due to the poor ergonomic position. So in this study, they took 12 surgeons with 48 procedures. They used specifically the NekSpine, but there are others, say, were being developed. And in one case, exoskeleton had to be removed because the surgeon required a great field of motion. But for the remaining 22 out of 24 cases, the surgeons indicated that they would use it again. And the collected data showed improvement in posture and reported improvement in the comfort. So I think this is super encouraging. Moving on with medical news, there is efficacy study for the Legs M20 lower body gait assist powered exoskeleton. And it's a multi-center randomized controlled trial that was published. The exoskeleton didn't improve walking independence more than standard therapy, but it was associated with a modest additional gain in lower limb strength using the motricity index. And I didn't include it here in the newsletter, but there was also an interesting study that when it comes to people with mobility deficiency, in-lab results always appear to be slightly better than tracking how those people move in the community. So, in other words, take it with a grain of salt. It's possible that the exoskeleton did improve walking independence, but just in the short bursts of movement, it was not capturable. Another point of view of interpretation here that was brought up by Dr. Jayaraman is that equivalency in itself is a success for the occupational exoskeletons. That if an occupational exoskeleton is capable of providing equivalent physical therapy to multiple physical therapists, then that itself is a win for the device. Moving on, as usual, if you like this content, please like, subscribe, and if you really like this content, please support this effort on Patreon. I'm experimenting adding a new section that is focused on first responders. First responders is neither just a purely occupational exoskeleton device, nor is it a military or defense. And there are now more and more reports of studies being done with exoskeletons and how they can help first responders, firefighters, search and rescue, post-assessment after an incident, and much more. So this particular news story is from BKS report that is going to be published, and it includes the German Bionics powered hip exoskeleton, and it's currently being evaluated as part of the ExoFire project with the Berlin Fire Department and Charlotte University of Berlin. So the results are expected to be in early 2026, and we will see what they say. Obviously, there's a lot of considerations, but at the same time, not all exoskeleton use has to be while an incident is transpiring, while there's an active open flame. Exoskeleton can be used in post-retrieval, post-inspection, post-cleanup, where there still isn't access to power tools, ramps, elevators. So it will be interesting to see what the evaluators think of it, and expect more news on this topic in the near future. Moving on to podcasts, this week has featured quite a few of them. Beyond the Skin has a new episode focusing on the investigation of what happened to the Hardiman project, which is a 60s, 70s General Electric-led full body powered exoskeleton prototype project. So check that out on YouTube. EHS Leaders has published an episode with Dr. Carl Zelik from HeroWare on new studies of the use of exoskeletons in the workplace. And the episode mostly focuses on the evidence that HeroWare and others have been able to collect in recent years that both show efficacy improvements and and that there is no visible evidence of any of the hypothesized perceived new additional risks. Finally, the Humotech podcast has another episode, once again with Dr. Matt Dickinson being featured in this one. So Matt is in 2 of the 3 podcasts this week. And this one is Advancing Exoskeleton Adoption Through Safety Standards. And it's a really good overview of the last few meetings of Committee F48, Exoskeletons and Exosuits. I've been part of those meetings as well with Dr. Dickinson, and I think that he does a wonderful job in a really conversational way, explain the work that has been happening over the last year or so and why it is being prioritized, what are the objectives that the community is trying to meet. So if you are at all interested in understanding the current state standards and how they apply towards getting us to being able to certify exoskeletons and to reduce the uncertainty and confusion around this field, I recommend that you listen to this one as well, or at least save it to listen to for later. Moving on to the technology side, there's Most Curious evaluation study on the capability of a dual motor hip-only exoskeleton to prevent falls and be useful as a balance tool. Now, obviously, since this is a single motor per hip that goes only in one direction, the study focuses only on stumbles, like you're walking forward and you stumble while walking forward, or you lose your balance and you end up leaning directly backwards. The exoskeleton has no capability to assist with balance side to side. It's only in one singular plane of motion. Regardless, I have always thought that a single motor hip exoskeleton would have no hope of improving balance while walking. So this paper caught me by surprise and has made me evaluate my own understanding of what is possible, because the results seem encouraging that yes, with the correct timing and application of force, it can be used to fight against perturbations and to help improve balance. Finally, the last research study is a systematic way to be able to understand the level of comfort, but not physical comfort, but more mental comfort and adaptation towards an exoskeleton. So the gist of it is we know that different exoskeletons require a different amount of time for the body to fully get used to it and for it to become more of a transparent system. I think this is very similar to going on a bicycle, learning how to ride bicycles, or I heard this example in video recently, going on one of those horizontal people mover, horizontal escalators that you see in airports. Like the first step is the toughest, and then your body adjusts to it. And after a while, you kind of forget that you're even on it. So the idea here is, can we use onboard sensors and motion data from the exoskeleton to understand what is the comfort level of the user, what is the adaptation level? And that should ultimately reach some sort of horizontal asymptote, which would most likely be completely different from person to person. And what exactly one would do with this data is also questionable, but I think it's a really interesting question, and it could also give a hint as to the fit. If the data indicates that the person has reached only partial synchronization with the exoskeleton, maybe that could be a signal to check for fit or check for something else that might be happening there. So it's curious to see like how researchers and scientists keep pushing the frontier forward on a weekly basis with this technology, and it's really super encouraging. Speaking of pushing the frontier forward, I continue to see a massive amount of job openings that I have not seen in previous years in the exoskeleton industry. So I added 6 new positions at H3s that range from internships to assembly and sales. There's positions at Robotics, Northern Arizona University, Angel Robotics, University of 20, Bionic, Wondercraft, Defy, and these are just the ones that I have seen. There's a good chance that there's other open positions out there. At this point, there really isn't a centralized job board, and there really hasn't been much of a volume in the past of open positions to justify one. So I'm kind of like playing with this section here, just listing them in text form and providing the links. All of these are clickable links that go directly to the postings. Finally, in the events category, there's quite a few still scheduled for this year. Check it out in the calendar. I will not read them one at a time, but all of these are clickable. So you can click from the newsletter. It will take you to the calendar, and then the calendar, you can click on any of the pictures, and then that will give you the information, and then all the relevant links. If they're not in the body of the text, they're always in the bottom in footer area. And thanks to our strategic partners, to all of our subscribers, heartfelt thanks to all of our Patreon supporters. Wouldn't be doing this without you. Check out the website if you want to advertise on this. There's opportunities for that as well. And don't hesitate to give me any feedback, suggestions, or ideas. And with that, I wish everyone a good and a successful week. Ciao!